Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let us speak about Mirena, which is one example of levonorgestrel-releasing intrauterine system. So what is our objectives today? What is the definition of Mirena, the mechanism of action as a contraceptive method, the description of Mirena, what is the contraindications, what is the non-contraceptive benefits of Mirena, and what is the complication, and what about the failure rate, and lastly the skills of insertion of Mirena. I'll do it on a mannequin at the end of this lecture. Okay, so Mirena is a levonorgestrel releasing intrauterine system that can provide long-term contraception. Okay, so it is one of long-term contraceptive method, levonorgestrel releasing intrauterine system. The duration of Mirena as a contraceptive method, 5 years, approved from FDA. But recently, it was found that the Mirena can act up to 8 years. And this is recently discussed in many updated papers. Okay? So, from 5 to 8 years, yes, it can be used. What is the mechanism of action? The main mechanism of action to prevent fertilization by doing a change in the amount and the viscosity of cervical mucus. These changes makes it impermeable to sperm and impenetrable to sperm. So sperm can't pass the cervical mucus. These changes of cervical mucus caused by the levonorgestrel-releasing intrauterine system, Mirena. Okay. Another mechanism of action, inhibition of sperm capacitation. Another mechanism of action to prevent fertilization and to prevent implantation and as a method of contraception is the changes in the endometrium, alteration of the endometrium. There is thinning of the endometrium with time. So it is site not suitable for even implantation of fertilized ovum. Lastly, in some women, there is suppression of ovulation, but you cannot guarantee suppression of ovulation on all women. So we can say partially suppress ovulation. Okay? Okay. What is the description of Mirena as you see in this picture? It is a T-shaped polyethylene frame with steroid reservoir. This is the reservoir which contain levonorgestrel 52 milligram, and the amount released every day about 20 microgram every day. So the reservoir contains levonorgestrel 52 milligram. This is the total amount of levonorgestrel. The amount released every day is 20 microgram. Okay? Okay. Mirena is intended to provide, as I said before, 20 microgram of levonorgestrel. This rate decreases progressively to approximately 11 microgram per day after 5 years and 7 microgram per day after 8 years. So with time, with years, after 5 years, in spite of 20 microgram per day, as I said before, in the first 5 years, this amount decreased to be 11 microgram per day after 5 years. And after 8 years, it is about 7 microgram per day. This T-shaped IUD is 32 millimeter in both horizontal and vertical. So it is 32 millimeter in both horizontal and vertical. The polyethylene of the T-body is compounded with barium sulfate, which makes it radio-opaque. A monofilament brown polyethylene removal thread is attached to a loop at the end of the vertical stem of the T-body. Here is the thread, polyethylene, monofilament brown in color. Okay? Attached to the loop at the end of vertical stem. This is a vertical stem, this is a transverse. Okay? Threads at the end here. This threads is important because when we want to extraction to Mirena, we just grasp the threads with forceps to remove the IUD out. The inserter. This is the inserter of Mirena, as you see. Mirena is packaged sterile within an inserter. The inserter, which is used for insertion of Mirena into the uterine cavity, consists of symmetric two-sided body and a slider. This is a slider that are integrated with flank. This is the flank in the picture. Lock, pre-bent insertion tube and the plunker. This is the insertion tube, and this is the flank, and this is the slider. Okay. Once Mirena in place, the inserter is discarded. What are the contraindications for insertion of Mirena? Pregnancy or suspicious of pregnancy, congenital or acquired uterine anomaly, including fibroid, because fibroid may distort the uterine cavity. But if subserous fibroid and not related to the uterine cavity, you can do it. But I'm talking here about fibroid that occupy part of the cavity, so it is contraindicated. Or congenital uterine anomalies, like septate uterus and so on. Acute pelvic inflammatory disease or a history of pelvic inflammatory disease, another contraindication. Postpartum endometritis or infected abortion in the past 3 months. Known or suspected uterine or cervical neoplasia or unresolved abnormal pap smear. What are the other contraindications? Genital bleeding of unknown etiology. Don't insert Mirena in a woman complaining of vaginal bleeding and we don't know the etiology. She is not yet diagnosed, okay? Because there may be malignancy, for example. Also, one of the contraindications, untreated acute cervicitis or vaginitis, including bacterial vaginosis or other lower genital tract infection until infection is controlled. So if you wanted to insert Mirena and you discovered vaginitis or cervicitis, please manage first the infection, then you can insert it. But if the infection in the upper genital tract, I mean BID, no, it is contraindicated to insert Mirena even after treatment. Acute liver disease or liver tumor, whatever malignant or benign, condition associated with increased susceptibility to pelvic infection. If there is hypersensitivity to any component of this product. Last contraindication, known or suspected carcinoma of the breast. Known or suspected carcinoma of the breast. What is the benefit of Mirena rather than being a contraceptive method? It improves heavy menstrual bleeding. So if a woman using copper IUD, for example, and have heavy menstruation and you did removal of the IUD, you can use Mirena. It will decrease the menstrual blood. Or even with idiopathic heavy menstruation, I can use Mirena to reduce the menstrual flow, reduce the blood loss. Also, one of the benefits of Mirena, it improves cramping or pain with period. Also for treatment of pain due to endometriosis, treatment of pain due to adenomyosis, treatment of simple endometrial hyperplasia without a tibia, improve anemia by decreasing the menstrual blood loss. What are the complications of using Mirena? Maybe headache, acne, sometimes breast tenderness, irregular bleeding may be noticed in the first 6 months of use, but this improves with time and the patient become hypomenorrheic, then amenorrhea may happen and there is no bleeding at all. So you should reassure the patient if she has irregular spotting at the first few months after insertion that this will improve with time. Mood changes, functional ovarian cyst may happen, and this ovarian cyst will resolve spontaneously. So don't worry about the functional cyst. After 1 or 2 months, it will disappear completely. Rare complications like expulsion, method failure, or perforation of the uterus rarely happen. What is the failure rate for women using Mirena? Really, Mirena is one of the most important and potent contraceptive methods. The reported 12-month pregnancy rate were less than or equal to 0.2 per 100 women. And the cumulative 5-year pregnancy rate was approximately 0.7 per 100 women. So it is less than 1 per 100 women. 0.2 if we measure it all over 1 year per 100 women, 0.7 per 100 women if we measure that over 5 years. Okay, so it's a very efficient method of contraception. Lastly, how can I insert Mirena? I'll do it on a mannequin, so watch it. It is important. It's a very important skill. Insertion of Mirena using the inserter specified for it. Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. So, how to insert levonorgestrel-releasing intrauterine system, or what's called Mirena, for example. Okay. What is the needed instruments? I need self-retaining metal vaginal speculum, graves or casco speculum, graves like this one, or casco speculum. I need valcellum to hold the anterior lip of the cervix. I need uterine sound to measure the uterine length. Okay. Then what about the insertion of the Mirena? Okay. First, look to this, please. This is the system, and this is the Mirena, which is released inside the uterine cavity. This is the insertion tube. This is the flank. The insertion tube graduated by centimeter, and you put the flank according to the length of the uterine cavity. You can push it down or up according to the length of the uterine cavity. So if it is 5 centimeter measured by uterine sound, you will put the flank on 5 centimeter or above, and so on. Okay. What about this part? This part is a slider, and this is a mark. There is a mark here. While the slider on this mark, the transverse arm is out of the insertion tube like that. Okay. When you are going to insert the intrauterine device or system, you will push the slider up. Why? To withdraw the arm to be inside the insertion tube like that. Okay? Okay. And you keep it up like that. Don't leave it. Okay? While it is inside, you are going to insert it as I will do on the model like that. Please lock to this. I insert it inside. First resistance will meet me, the internal os, then the second resistance will be the fundus. Then withdraw little bit downward like that. Why? To leave a space for the transverse arm to come out. Then next step, what I'm going to do, you remember the slider? It is up, yes? Yes. I'll push it down to the level of the mark here. Okay? So this is the first step. Why? To release the arm. Lock. The arm is released, as you see. Right? Okay. Then there is another grade down for the slider to release the whole system. The whole intrauterine system. The Mirena. Okay? Lock to this. I'll push it down. And keep my finger pressing it down while I'm withdrawing the insertion tube from inside the uterus like that. Okay, this is how to insert. At the end there is threads coming out from the external os. You will cut it about 1 centimeter to 2 centimeters from the external os. This is how to insert Mirena. And as you see, Mirena has 2 transverse arms and 1 vertical arm. The 1 vertical arm containing the reservoir, which contain levonorgestrel 52 milligram and the releasing 20 microgram every day, and you can keep it inside the uterine cavity up to 5 years if there is no any complication. Thank you.